Next, I call upon Dr. Aditi Mishra. Dr. Aditi Mishra.
Good afternoon, everyone. Today, I, Dr. Aditi Mishra, presenting a paper on ocular ultrasonography and SD OCT to distinguish between grade 1 and grade 2 papilledema and pseudopapilledema, co-author Dr. Professor Eva Tirki. Introduction: the differentiation between the two is a challenging task, yet critical decision needs to be made. Often, patients with true papilledema are being confused with pseudopapilledema. The modalities such as B-scan and OCT can be a cost-effective invasive outpatient procedure that helps in the diagnosis and the management of the patients with optic disc edema and papilledema. Now, aim is to evaluate the role of ultrasonography, especially in grade 1 and grade 2 papilledema. Also, analyze the optic nerve head and peripapillary retina using SD OCT. Materials and methods. Study design was a cross-sectional observational study. Study center was SSMC Riva. Duration was September 22 to March 24, and a sample size of 60 patients was taken. Inclusion criteria: the patients with have a grade 1, grade 2 papilledema, and the other group was pseudopapilledema. The exclusion was the children below the 18 years of age and patients with hypertensive retinopathy, diabetic, or traumatic optic neuropathy, and the patients which have the grading greater than grade 2. Now, the patient underwent comprehensive general examination and comprehensive ophthalmic examination was done. In ocular ultrasonography, the following parameters were taken into consideration, such as optic nerve sheath width of greater than 3.3 mm, 30-degree test, which is the decrease in the optic nerve sheath width by 10% on abduction. On B-scan mode, the elevation of the optic disc, and we also look for the crescent sign. For spectral domain OCT parameters, we have taken into consideration PRNFL, brush membrane opening, optic nerve head volume, and GCIPL thickness. In the total, 60 participants were taken. 30 were papilledema, which included grade 1 and grade 2. The other 30 was the group of pseudopapilledema. This is the chart, bar chart showing the optic nerve sheath diameter, which was increased in 20% of 20 patients. Total 30 patients were taken. In the other, the optic nerve sheath, the 30-degree test was found positive in 73% of papilledema. However, the same was found only 30%, 37% positive in patients of pseudopapilledema. The other in OCT in papilledema and pseudopapilledema, we have generally taken the PRNFL and GCIPL. PRNFL was increased in patients of papilledema. However, GCIPL thickness was decreased in the patients of papilledema. Brush membrane was comparable in both groups. In a study, orbital ultrasonography is found to be a sensitive tool in diagnosis of low grade, which is comparable to SB Carter et al., which has a sensitivity of 90% and relatively higher than 60% in Cole et al. However, in our study, along with the optic nerve sheath diameter and 30-degree test, we have also taken into consideration the crescent and donut sign. The median RNFL thickness was greater in papilledema as compared to pseudopapilledema. The Bessie et al. In this study found increased RNFL thickness in all quadrants. Conclusion: ocular ultrasonography and spectral domain OCT both can be used to distinguish between papilledema and pseudopapilledema. 30-degree test was found positive in greater degrees of papilledema than pseudopapilledema, and SD OCT parameters RNFL was raised, however GCIPL was decreased. Both can be useful in guiding the management and the diagnosis in the patients whom the diagnosis is uncertain. These are my references. Thank you.
Thank you, Dr. Aditi.
Clinically, there is such a gross difference between, I mean, I'm just talking about the clinical presentation.
Yes,
there is a vast difference between pseudopapilledema and papilledema, isn't it, clinically?
Yes, ma'am. Clinically, difference is present, but this case we are taking early papilledema and pseudopapilledema.
Even early papilledema, you know, the symptoms are huge.
Ma'am, early studies have been done taking into consideration B-scan and SD OCT parameters also.
No, the clinical examination I'm talking about. Clinical examination of early papilledema.
Ji ma'am. Fundus examination, Friesen grading can be done.
Not just the fundus examination,
yes,
other examination.
Yes, perimetry and color.
Early papilledema. I mean, without any, I'm talking about clinical examination. not about the perimetry or, you know, about the papilledema, early disc blurring and all that. Compared to that, pseudopapilledema, there are hardly any symptoms, isn't it? Symptoms.
Yeah, ma'am. Symptoms are not there, but
so the question here is, you know, is it necessary to, you know, investigate, do all these investigations in a child who has pseudopapilledema, because the clinical symptoms of papilledema are so huge.
Ma'am, in certain cases where drusen's
the
are
clinical
present.
correlation, I think, with this is extremely.
Yes, ma'am, I agree with that.
essential.
I agree with that. But in certain cases, the optic disc drusen and patient can present with headaches also. So we can help with this tool. We can differentiate between the two.
But the incidence of that is very low, isn't it?
Yes, ma'am. Thank you.